Hi everyone. Thank you for attending this virtual poster presentation. My name is Nick Mailloux, and I'm a PhD student in the Environment and Resources program in the Nelson Institute for Environmental Studies. And today I'm going to be talking about my research on the cross-state PM 2.5 related air quality health benefits and global climate-related social benefits of 100% clean energy in the United States. This is work that I've undertaken in collaboration with Nelson Institute alumnus David Abel and my advisor and GHI director Jonathan Patz. First, some background and motivation. The United States and countries around the world must achieve deep and rapid cuts in greenhouse gas emissions in this decade and by mid-century if we're to have a chance to limit global warming to 2 degrees Celsius, the primary target established in the 2015 Paris Agreement. At the same time, and partly in response to this call to action, states across the U.S. have recently been adopting ambitious climate and clean energy goals. 13 states, as well as the District of Columbia and Puerto Rico, now have targets of producing all of their electricity needs from clean and renewable sources. And at the national level, President Biden has established a goal of achieving 100% zero carbon electricity nationwide by 2035. And as these policies are being debated and implemented across the country, it's important to recognize the harms of our current energy system. Energy-related sectors such as transportation and electricity generation are primary sources of particulate matter pollution in the US, which causes anywhere from tens of thousands to hundreds of thousands of premature deaths each year. So with this project, we were asking the question, if we could flip a switch and tomorrow all sources of energy-related PM 2.5 and CO2 emissions were gone, what would be the benefits for human health and society at large? Answering this question required using two different methods, one to quantify the climate benefits and the other to quantify the health benefits. For climate benefits, we multiplied recent estimates of the total CO2 emissions resulting from the burning of coal, natural gas, and petroleum across 5 major energy-related sectors by federal government values for the social cost of carbon, which estimates the social damages resulting from the emission of 1 ton of CO2 into the atmosphere. To estimate health benefits, we used EPA's Co-Benefits Risk Assessment Screening Tool, or COBRA, a reduced form air quality model. Using this tool, we're able to zero out emissions of primary particulate matter and sulfur dioxide and oxides of nitrogen, which can form particulate matter once they're released into the atmosphere. We do this for the 6 energy-related sectors included in COBRA. Here's what we found. Climate benefits would total about $230 billion each year. Health benefits could total anywhere from $300 to nearly $700 billion each year. And with these emissions reductions, we could save between 29,000 and 64,000 lives every single year. The chart on the right describes the percentage of the total monetized benefit that comes from each of the 6 emission sectors that we modeled in COBRA. At the state level, we find that an average of 45% of the health benefits from a state's emissions reductions remain in that state, but this ranges widely, from 3% in Wyoming to 94% in California. The type of analysis described here is of particular use for policymakers as they weigh the cost and benefits of clean energy policy. But on another level, they provide a vision of a society in which fewer parents have to worry about their kids having an asthma attack while playing in the backyard, and a world in which we can all breathe a little easier. Thank you.